Welcome to today's episode of the Tennessee Community Engaged Alliance Against COVID-19 Wellness Wednesday Show, also known as TNCO Wellness Wednesday. I am Dr. Catherine Y. Brown, your host. Now, more than ever, we must continue to stay informed and stay engaged about the COVID-19 pandemic in Tennessee. Throughout our conversations on this show, we will continue to introduce you to thought leaders, researchers, academicians, and those who are engaged about COVID-19 in our community. Today, you are in for an absolute treat. It is with much excitement and anticipation that we bring to Wellness Wednesday Dr. Singh. Welcome, Dr. Singh. We are so excited to have you today. There has been so much excitement about you being here. So what I would like to do, as I looked at your background, your credentials, you are a dynamic researcher and academician. You're doing innovative things. But for those people who have not met you yet, can you give us an overview of your background? And I want you to share your work at Meharry Medical College, TNCO, and also the innovative things that you're doing related to COVID-19.
Thank you, Dr. Brown, for inviting me. For the viewers, I'm Rajbir Singh. I'm a physician by training. I did my MD from India. Came to Meharry, worked as postdoctoral fellow in the Department of Microbiology and Immunology. And then since I'm a physician, researcher, and I joined clinical trials department, and now I'm the director of clinical and translational research center at Meharry Medical College, and also co-investigator on Novavax vaccine trial for COVID-19 vaccines. I've been working on all kind of trials here, cancer trials, all respiratory trials, cardiovascular trials. And when this pandemic came and we've been approached by vaccine trials, CoVPN network, vaccine prevention network, and they asked us to participate in their trials. And Novavax trial was conducted here, and we finished the enrollment. Trial is going really well. And also, as you guys know, that Harry has been doing the testing for the city, and I've been involved with that also, being there and testing participants and swabbing them when COVID-19 was at its peak. And with Tennessee Seal, our job is to promote, knowledge, education about COVID-19 and also about vaccine and vaccine trials. And that's what we are doing right now.
Thank you so much. It's so exciting when I listen to you talk and all the things that you have done when COVID-19, as you say, was at its height and till present day. So here's a question that we often get, because throughout the week, viewers send us questions. And one of the main questions we keep getting is, how can we actually keep ourselves healthy against the COVID-19 virus?
Yes, as you know, the saying goes, prevention is better than cure, right? I would say that try not to get infected. That's the first thing we say. Wear mask, and wash your hands, whenever you touch something which is frequently touched by others. And also maintain social distancing. That's the first thing, you need to do. And try, if you happen to touch anything, try not to touch your T-zones, eyes, nose, and mouth. That's how it spreads the most. The social distancing is the key, because the virus particles can stay in the air for some time, and distancing can help prevent the spread of the infection. And also try to live in a healthy lifestyle manner. Eat healthy, eat on time, and do exercise daily. And if people's lives are busy, they hardly sometimes get the time to go in the sun and sit there to get the vitamin D. Go and sit in the sun for 10, 15 minutes, and to have that vitamin D, replenishment naturally done by the sun. Take vitamins, supplements if you can, on top of your, food. And that is what you can do currently, like at home, like without doing anything extra, to keep yourself healthy. And other thing is, right now vaccine rollout is there, right?
Mhm.
The first frontline health workers are getting vaccinated, and also participants who are, people who are at the age of 75 and over, or living in nursing care facilities, they are getting vaccinated. And now the age criteria is going to be decreased, going to 65, and eventually everybody will get vaccinated. So vaccines are another ways you can keep yourself healthy.
So, thinking about the communities that you're serving through the TNCO program, who are the communities that you're serving and what can they do to get vaccine ready?
So communities we serve here, our patient population that comes to Meharry Medical College, as you know, is more than 50% from the African American communities and Hispanic population.
Mm-hmm.
Those communities are underserved, as you know. The Meharry does a very good job of serving those communities. And what they can do to get vaccinated is that they can stay in touch with their provider, and if they are eligible to get the vaccine now, they should get on the schedule and
Mm-hmm.
don't miss it, because right now, as you know, dosages are limited. So if you get scheduled, try not to miss that. Make it a priority to go there and get vaccinated, and also try to get the date for the second dose. So majority of these vaccines are two dosage vaccine. You need to get the second dose to get um, full immunity. And also, vaccination doesn't mean that you are fully protected. You still need to maintain those social distancing, wear mask, and wash your hands, and all those practices needs to be done. As you know that the antibody production takes some time. You don't immediately start to produce antibodies against the virus after vaccination. It takes time,
Mm-hmm.
and the vaccination helps in the way that it protects you from a severe disease, and also helps in some extent in spreading the infection. So you can still get infected, but the severity will be less. That's how they help.
I love it. And I want to make sure that I re-emphasize something that you just shared for the viewers. You said make sure you make your appointment,
Mhm.
keep your appointment, and follow up for the second dose. And that's very important. I know that there are so many things that, competing priorities, but I think what we're hearing Dr. Singh tell us is that we have to be proactive,
Yeah.
make the appointment, keep it, and get that second dose.
Mhm.
Yeah. So here's a large question. I want you can look at it from any angle, but we hear the word community. So, in your words, what does community mean to you?
Yeah. My understanding is that it starts from your family, right? So,
Mm-hmm.
the group of people who share the same values, uh,
Mm-hmm.
same religion or same socioeconomic status, or the level, is like similar. And then you extend it to neighborhood, and then extend it to your, city, and beyond. That's what you call it community. So where
Mm-hmm.
you can relate to each other, either by race, religion, or socioeconomic status, or the difficulties you face, in all aspects of life. So that's what constitute a community for me. So and yeah, I don't know what else I can define in a different way.
I love that you emphasize it because oftentimes when people say community, they think that maybe we're talking about someone else or something externally. But
Mhm.
what you reminded us of is community starts in your home and making sure that you are following the guidelines for your family. So I love that. It's beautiful. So Here's the word: success.
Hmm.
If your work is successful, what does that look like and what does it mean for us?
So success for our work is when enough participants enroll into the clinical trials, into the research, and then that research outcome is beneficial to the society or communities as a whole, or the nations as a whole, or the world as a whole. That's what the success is. What you do, what you intend to do, that comes to visualize, come to fruition, right? Comes to people can see it. What you were trying to do, you achieved it. That's what the success is. And for success against COVID-19, it will be when we can eliminate infections. We can be successful against this pandemic, and people can normalize their lives as it was before COVID-19 hit. So for us, for on vaccine trials, the success also means that, okay, vaccines which we conducted trials, they are coming out to be safe and effective, and people are ready to enroll and ready to schedule themselves to receive those vaccines.
We have a question coming in. There's a lot of people, they really love today's conversation. But the question is, what can the community do to help? They're watching you, they're learning about your work, but they don't know what should they be doing. What can they do to help?
I mean, the help from the community starts from the home, as I say. Like, what you preach, if you don't start from yourself, it will not be seen as a good thing. Like, if I'm saying, okay, maintain social distancing, wear mask, wash your hands, and try not to touch your mouth, and then I do the same thing, and that will not be taken as a good thing, right? So that's what I would say. The communities, they can start from home and then spread the message in the neighborhood, and then like today's world, social media, like we are spreading right now, social media, you spread the message. Whatever you think is working against COVID-19, spread it. People can follow that. That's how communities can help, and they can help in with education also, because there are so many myths against vaccines, especially that it can cause this and it cause that, and autism and all other myths are there which have been proven to be false, and people are scared also whether these vaccines are safe. These vaccines are very safe. The data is showing that the occasional anaphylaxis kind of reaction which is happening in only those participants who have a history of allergy in the past, either to any drug or to the food. And those participants are, if they have the allergic reaction, it's happening right in front of the doctors while they are waiting uh, 30 minutes after the vaccination. So they have been taken care of. So these things are important, and people need to understand it can happen, but these are happening only in a very few percentage of people, like 5% or so. So, and also, other question we get from the people is that the vaccine process or vaccine trial production process or trials take longer time. Now it is done at a very fast speed, warp speed. Uh, so nothing has been compromised in terms of the safety measures, in terms of the trial conduction. Only thing that was sped up was that the participants enrolled on the trials were at a very high rate. Like usually you enroll 20,000, 30,000 participants over 10 years or 20 years, right? On these trials, they were enrolled in a matter of months.
Mm-hmm.
But the integrity of the trial was not compromised. So since the infections were more in the population, they were able to compare the the infections in placebo group, participant who didn't get the vaccine, versus vaccine group, in a faster time frame, because you enrolled now enough number of participants, now you can see the infection and then compare the data. Once you have the data, it's independently observed by the independent boards, and nothing has been compromised. That's what I'm trying to tell. And then it goes to FDA, then approval comes. So these vaccines are very safe, and people should try to, get it. And that's how communities can help.
I love that. And it's something that you said that was very powerful. And I hope people heard that, is not listening to myths, but that the integrity of the process was not compromised. And I think that's probably a miseducation that is occurring in the community. So I'm very excited that you emphasize that for people who are looking. So our time is coming to an end so quickly, and there's so many more things I want to ask you, but I think I'm going to ask one final just question. What is it that maybe that you haven't shared that you want to share with all of our viewers nationwide that they need to know? And it could be anything that you want to share.
I really can't think of anything like that, but what haven't shared? I mean, regarding COVID-19?
Yeah, I think regarding COVID-19 for sure, because yeah,
it's okay. I came to me. So good. The vaccine trials are giving, or vaccines currently rolled out, Pfizer and Moderna. The data is showing that the two vaccine produces enough antibodies, right? It's very 94% effective and safe. But there's another data which is showing that the people who got infected with COVID-19 and recovered, they are producing a stronger immune response even with one dose. So there will be trials where people who have got infected and recovered, they will get only one shot, and they are producing stronger immune response as compared to the people getting two dosages on the vaccine trials. So that is what I would like to say, that people should try to get the dose at least. You may not know whether you were infected or not, but when you get the dose of vaccine, even if you get one dose, that may protect you much better, than not getting the dose at all.
Well, thank you so much for being with us today. We are just excited to meet you. And so for them to find out more information about you, they can visit the website, www.tnseal.org. And they can also follow that hashtag TNCEAL.org. Thank you again, Dr. Singh, for being with us today. For our viewers around the world, I want to personally invite you to join me back here next Wednesday for TNCEAL Wellness Wednesday. You won't want to miss an episode, and be sure to share this message using the hashtag TNCEAL. Until next time, you know what I'm going to say. Stay informed, stay healthy, and share this message with your community. Until next time, friends, I'm Dr. Catherine Y. Brown, your host. Have a great day.